You know, it's bad enough that women are disregarded in the healthcare system. And then on top of that, I'm a Black woman.
I know once I started using mobility aids in the system, I felt like I was seen as like secondary.
Like I was very stuck, and I basically was putting a cry for help out there to the community of saying, I'm in this situation. Sorry. Yeah, it was, a really tough situation to be in.
Today, we're talking about disability healthcare.
Deep conversations, real honest stories, and complex, relevant issues all examined through a disability lens. This is In Focus.
Hello, I'm April Hubbard. Many Canadians with disabilities rely on support care at home to maintain their well-being. But as you'll hear in our next story, support care is not without its challenges and in need of some improvements.
Should I put this on the med tray?
Every day, Andrew Jantzen manages a rotating staff of support workers from his apartment in Halifax. Today, they are helping with the organization of Andrew's medication.
My support workers do a lot of different things. In the morning, when they get here, they help me with taking my meds and using the washroom, taking a bath. We do all of my feeding tube things. We also do things like going out of the house, getting groceries.
Andrew's support workers are essential.
I have a connective tissue disorder called Ehlers-Danlos. I use a power wheelchair, and I have different like braces and splints that I use because most of my joints are hypermobile and they come out of place on their own. It causes a lot of pain. So now we just need to do Wednesday morning and afternoon.
In 2020, he switched from home care to self-managed care.
I didn't necessarily choose it. I was in a situation where I had home care from an agency, and they, partially because of the pandemic and partially because of the ongoing issues with the home care system. So I was, told at one point that I wasn't going to have workers for the next 2 weeks.
In the midst of his home care crisis, Andrew started his blog, Tales of a Home Care Castaway.
I had no one to help me and just had to recruit volunteers. I was very stuck, and I basically was putting a cry for help out there to the community of saying, I'm in this situation. Sorry. Yeah. It was, a really tough situation to be in, and to have to ask people for that kind of help.
Andrew's friend, Hannah Wood, pitched in to help.
I was so frustrated and angry that more could not be done. Andrew is a young adult with a career and a social life and friends and a romantic life, and he deserves to live all of those to the fullest, but home care is not designed that way.
And moving to self-managed care wasn't simple.
You take on all of the responsibility for hiring and managing your own workers instead of a company doing it. It's essentially like starting your own small business. It's different than home care in the sense that home care from an agency is only allowed to do certain things. So having self-managed care allows me to do a whole lot more than I otherwise would.
It also cut down on the number of different workers coming through his home.
There were periods of time where it was never the same worker. I have a lot of labels up so that people can find stuff on their own, but it's just, people will never remember a routine if they're only there once. You're always gonna have to run through every single little thing that you need and what you want from somebody.
Self-managed care has helped in other ways too.
I'm queer and I identify as multi-gender, and things around like gender and sexuality, the type of competency and training that people get is not necessarily there. And so I've had a really tough time, and that's really hard when this is your own home, your own environment, you're naked, you're in vulnerable situations where you're getting personal care from people, and the level of It's not that people are not necessarily trying to be respectful, but they just don't have the training. The only option I was given was, again, like the self-managed care program and then providing all the training myself.
In addition to managing his home care, Andrew works remotely for the Tetra Society of North America and has a passion for food.
I think I'd like to make some food. What do we have to work with?
We have some onions and some potatoes.
I think we could make the potato bacon leek soup. I really love food, which is kind of funny when you think about having a feeding tube, because I have trouble eating by mouth, and so I have to adapt things. I actually have a food blog, so my workers, they help me be able to be a part of the food process too.
While Andrew is managing currently, his experience has allowed him to see some cracks.
The expectation is that you'll have a backup plan at any given time. Some people's backup plan is 911 because that's the only option. Like, how else is someone going to get nursing care?
Another issue is salary. What wages Andrew can offer workers is governed by what he receives in funding.
It's very important to have raises for people in the healthcare system so that people have their work valued.
As a result, staff turnover can be an issue. Despite its flaws, he believes the program is worth improving.
Right now, I guess it's kind of a particular situation. Like, I've come a long way in terms of setting up the program and getting a lot of things put into place that are really helpful, but there's still challenges with the program. And those challenges with the program need to be addressed in order for people to be able to use this as like a thing that we can say, this is an awesome program, this is very helpful, and it can help people live full lives. It's worth fixing these programs so that we can have these benefits for more people.
Coming up, barriers to healthcare.
I feel like the majority of the time I'm kind of seen as like an unreliable witness to my own conditions.
In Focus will be right back. You're watching In Focus.
We're talking about disability, healthcare, and accessibility. I'm joined now virtually by two guests who have a lot of experience with our healthcare system. Serena Thompson is a patient advocate and former interim vice president of the Sickle Cell Association of Ontario. She lives in Toronto. Maeghan Taverner is an actor, dancer, choreographer, teacher, and graduate student. They are disabled, have several chronic illnesses, and live in Bedford, Nova Scotia. Serena and Maeghan, welcome to In Focus.
Thank you, April. Thank you for having me.
Thanks, April. Thanks for having me here.
Can you both tell me about your disability and how it affects your day-to-day life? Maeghan, would you like to start?
So I have multiple chronic conditions and a few rare diseases. Mainly I have POTS, which is postural orthostatic tachycardia syndrome, and then a few rare conditions that are superior mesenteric artery syndrome and nutcracker syndrome. So mainly these affect my body in various ways. So they are considered dynamic disabilities. So it's kind of up and down throughout the day. I use a variety of mobility aids, including canes, walkers, and wheelchairs to get through my day-to-day life, dealing with fatigue, pain, dizziness, and nausea. But with the right combo of medications and mobility aids, I can get to living life.
Well, I live with sickle cell disease. The way it affects my day-to-day life, it affects me physically. One way is, I wake up very stiff in the morning, very achy, and then throughout the day, it takes me a while to get myself moving and mobile. And then day to day, there would be daily pain. It could be called a crisis as well, where, there is my blood is oxygen deprived. So the blood releases the oxygen too early out of my system, and that way it's not being delivered to all the organs in my body. So that also affects me.
Those are all complex conditions to learn to live with. Maeghan, you had a long journey to get to your diagnosis. What was that like?
I have very rare conditions. It's less than like 0.013% of the population will end up with these conditions. So I've been in and out of medical settings for the last 10 years. Initially just diagnosed with IBS, and my mental health history was really used against me. And basically all my symptoms were brushed off as anxiety or depression or my OCD. And it wasn't until I actually did my own research, connected through support groups online, talked to other people with really similar symptoms, that I kind of found these vascular compressions and these autonomic nervous system disorders. And I kind of went to one of my specialists who had no idea what the conditions were, who sent me to another specialist who's like a general medicine doctor. And for the first time in 10 years, had a doctor who listened to me and appreciated that I went out and did my own research. And so she finally agreed to kind of look into these rare conditions. And eventually we did the right combination of testing and found out what conditions I had. And that was just really freeing to finally have answers for all of the pain, nausea, all of the things that my body was going through, severely malnourished, just so many questions that were finally answered.
That validation must have come as such a relief. Serena, as people with chronic illness, we often have a complex relationship with emergency departments. What has been your experience with ERs?
Well, it's been vast and very interesting. My experience with the emergency room was not a good one for a very long time. I've had to go into the emergency room, have to convince the doctors, that my pain is at 10 and above.
And I've often heard you speak about how you and others with sickle cell disease are often stigmatized in the ER.
We're looked at as addicts or just not addicts, but drug seekers. The part where we're not believed at how severe the pain is and how much we need that to be managed as soon as possible. So we deal with that with the doctors. We'll plead to the nurse. We'll be very upset. We'll be maybe crying. Some people get their aggressions out differently. And then we have to deal with security, because then now security comes in and interferes. It's one big mess after that. The reason why this happens is because we wait too long to go to the emergency room. We'll try to manage our pain at home just to avoid going to the emergency room to deal with all of those extra issues that, shouldn't have come up in the first place if we were believed about our pain at the beginning.
Yeah, I noticed all three of us were nodding during that whole conversation. Thank you for being so open and sharing that, Serena. Maeghan, there are many stigmatized intersections of our identity which affect how a patient is viewed by a healthcare provider, and which, as Serena mentioned, can affect the level of care we receive. How have the intersections of your identity affected your relationships with healthcare providers?
I feel like the majority of the time I'm kind of seen as like an unreliable witness to my own conditions, because I'm young, because I am feminine presenting, because I'm queer, because of so many other things, and because I'm mentally ill and neurodivergent. There's just like so many aspects of my identity that I don't present in various ways that I think that they expect me to present. And I find a lot of the time I obsessively research the conditions that I have, just because not a lot of doctors have experience with the conditions that I have. I was once accused of having Munchausen's syndrome after I used a bunch of medical terminology, because there was there's no way this young feminine presenting person can know that much, so they must be faking everything and must be doing this to themselves, so we're gonna do a psychological evaluation before we continue. I was like, how is that okay? How is it okay just because I look one way, but because I've educated myself and I have to do this for self-preservation to be able to get the care that I need, then that's turned against me. And I don't want like my body just to be medicalized the whole time. So I'm trying to come across like as a person to them so that they treat me as a person and not just like another body. I feel like doctors aren't trained on how to like properly deal with intersecting identities and kind of intersectionality. So I feel like if there was a bit more training in that sense and an understanding that each patient is a person first and not just a medical anomaly, I think we can get a lot more accomplished then.
There's certainly a need for more understanding. Serena, how do we combat the myth that pain looks the same on everybody?
All they have to do is just listen and believe. I mean, we're not going, trust me, we do not want to be in the hospital and we do not want to waste anyone's time.
Your response just made me quite emotional, actually. It's something that I've experienced too. And the idea of just being believed sounds so simple. And hopefully it's something that we can get to in our healthcare system one day. We're going to take a short break now, but there's still lots more to discuss.
In Focus will be right back. You're watching In Focus.
I'm here with my virtual guests, Serena Thompson of Toronto and Maeghan Taverner of Halifax. We're talking about accessing healthcare when you have a disability. Okay, have either one of you ever been accused of being a red flag patient?
I know for sure I have been, but it's never talked about. Well, we call it blacklisting. You know, it's because of the wording of how we are described as a patient. You know, patient wasn't complying, you know, and then doesn't put the explanation as to why, kind of thing. You know, it's bad enough that women are disregarded in the healthcare system. And then on top of that, I'm a Black woman. And then have to have like all these professionals who are predominantly men and having to explain to them all these different issues that we are going through and so forth. And then we feel like, well, how are you going to understand? You're not even, you know, you don't even understand the culture. You don't understand, you know, certain things like that. It's hard.
Yeah, it really is.
Yeah, Maeghan mentioned, yeah, we're human first. There should be no excuse as to how we get treated in the healthcare system. We're human being first.
Yes, I couldn't agree more. It's a real problem when medical professionals don't acknowledge our humanity. Before I let you both go, I want to ask, what advice would you give to another disabled person trying to navigate the Canadian healthcare system?
I think the first thing I would say is constantly remind yourself that you deserve the proper treatment that you need. And I feel that a lot of the times we kind of get lost in the system. I know once I started using mobility aids in the system, I felt like I was seen as like secondary. It's really hard to self-advocate, and it takes a lot of experience in that system and building up confidence and working through a lot of medical gaslighting in the system. So if you are at all able and have a support system in place, definitely bring someone with you to an appointment. And I would definitely recommend writing a list of things before every appointment and bringing a physical copy. So if you're having a hard time being verbal, or if you're neurodivergent as well, I know for myself, I have a hard time talking in a lot of scenarios and issues communicating. So I found that writing all of the questions down onto a piece of paper, that if the doctor asks me and I get flustered, I physically hand them a copy of the paper for them to read and go through.
And Serena, you're not only a patient, but you're also a patient advocate. Is there anything you'd like to add to that?
You shouldn't be scared of going to the ER. That means they are not doing their job. I'm just trying to change that. I want to change that the ER is your best friend, basically, if we have the right staff and people and that have the knowledge and understand and first and foremost treat you as a human being.
I think a lot of the time we end up not believing in ourselves because of so many things that doctors or the medical system has told us about our own bodies. And I just like to remind people that you know your body best. If there's something going on or something doesn't feel right, the majority of the time you are correct.
A perfect point to end on. Maeghan, Serena, thank you both for joining me for this thoughtful conversation.
Thank you so much for having me here.
Thank you, April. It was wonderful to talk about this. It's a very important topic, and I appreciate you all having me here.
As we heard from our guests, disabled patients, especially those with intersecting identities, often face extra barriers in accessing healthcare. According to the World Health Organization, people with disabilities are 3 times more likely to be denied healthcare and are 4 times more likely to be treated badly in the healthcare system than non-disabled people. As a survivor of healthcare trauma myself, it is my hope that the experience of disabled patients becomes an important part of the healthcare education system, and that one day we can all enter a hospital without fear of being disbelieved, or worse, having control over the course of our treatment taken from us. That's it for In Focus this week. Thanks for joining us.
Host April Hubbard, producer Wendy Purvis, videographers Andrew Pickup, Matthew McGurk, editor Roland Borchert, reporter Jillian Gillis, narrator Grant Hardy, media accessibility specialist M. Williams, audio post Mark Phoenix, graphics Mike Smith, opening theme package composed by Matthew Monius for Matt Mac Music, senior producer Michelle Dudas, President and CEO David Arrington, copyright 2022 Accessible Media Incorporated.